Dr. Zorba Pastor joining us in the studio now.
We're taking your calls today at 270-9933.
Good to see you again.
Good to be here. Good to be here.
So before we get to the calls, we have some new recommendations about young people getting tattoos and piercings.
That's right. You know, back when I was a kid, tattoos were not associated with sort of the good life. And I remember when I was a medical student seeing some old people with tattoos thinking, boy, that's a thing of the past. Boy, was I wrong.
Oh, yeah.
Everybody
That's
has
exactly
tattoos.
it. Tattoos are just really, really common things. So the CDC, the American College of Pediatricians, the American Academy of Family Practice, has looked at this and said there's some common sense things that you should do. Number one, go to a reputable person who does tattoos, because you want to make sure that the needles are sterilized. You can spread disease. Hepatitis, syphilis, other diseases, any bloodborne disease can really spread between a dirty needle. I mean, that's what sharing dirty needles are about. Number two, before we went on, we said, how old do you have to be to actually get a tattoo?
I thought you had to be 18.
Yes. Well, you know, you have to be 18 to do a lot of things, and some people do them before they're 18. And that's where I think really childhood education and parents talking to their kids about tattoos are really all about. Rock concerts, you know, that's where you don't want to get a tattoo.
Don't get a neck tattoo.
And don't get a neck tattoo or a face tattoo. That is a good way to get yourself out of a job, because you may not get a job because of it. You want to be able to cover it when you go and look for a job. So I think common sense stuff.
Yeah. And what you put on your body, too.
That's right.
Is there any kind of a seal or a certificate that shows it's a licensed dealer?
Not that I know of. I don't know of any seal or certificate. I think using good common sense, going to somebody that's a reputable tattoo person, and again, at a rock concert, got to be careful.
Yeah, absolutely. All right, 270-9933, the number to call. We have some calls waiting. We'll get to your questions right after the break. Okay, we're taking your calls with Dr. Zorba Pastor, and we'll start with Betty in Madison. Hi, Betty.
Hello. I get like, it isn't really a bruise. It's more purple pink, and there's no trauma or anything to the skin, and it is under the skin. It's not elevated or anything. Sometimes they're circular, but sometimes they're kind of like
Are you on any
long strips.
Any medications, any aspirin that you take?
Yeah, I do. Yeah, I do take aspirin.
Aspirin is the most common cause for something like this. Often it's called microtrauma. You just sort of go like this, and if you're on aspirin, aspirin keeps the blood from clotting, so that's usually the most common thing. If it continues, what you really want to do is talk to your doctor about it, especially if you have any drug interactions. But aspirin's the most common thing that causes it.
All right. Okay, let's go to another Betty. Betty in Madison. Hi, Betty. What's your question?
My question is, I don't know where I'm getting this back pain from, but it goes down my one left leg, it seems.
Yeah,
what do I do to
sounds like sciatica, sounds like something that's
I just was to the doctor. It's not that.
Well, one of the things that sometimes is very difficult, you can have spinal stenosis. Again, it's a nerve in the back. It may not be sciatica itself, but it's a nerve that goes down, can go down into the leg, and it's really from the lower lumbar spine, L3, 4, and 5. And sometimes you can tell this with a test called an EMG. You need a good clinician, your regular family doctor or a neurologist to really make that, especially if there's muscle weakness that's associated with it. Get it looked at, because there are some treatments with drugs called gabapentin that can help.
Okay, great.
Let's go to Sue in Prairie du Sac. Hi, Sue.
Hello.
Hi, what's your question?
I was wondering if there's a difference in vitamins and supplements, such as if you get the ones from Walgreens or Walmart compared to...
You bet.
Good question.
You bet. That's a really good question. I'm always for the house brand, because they stand behind it. So if you get the Walgreens brand, the CVS brand, the Walmart, the Target brand, they want to stand behind it because they want to make sure their name is good. There also is a website called consumerlab.com. Consumerlab.com. It costs $25 to belong to the website, and they actually test vitamins and supplements. And if you go there, I think it's a great place to go to, because some of the vitamins, some of the supplements and vitamins don't really have much in them, and they will tell you the cheapest per milligram. So that's another big advantage to doing that.
What's your overall philosophy about supplements?
Well, I think if they keep you from eating right, they're the wrong thing. I have a lot of people say, I don't eat right, so I take a vitamin. And the answer is wrong. That's wrong. You've got to eat right. Plentiful fruits and vegetables that are colorful are the way to go.
But if not, would you take fish oil,
a multivitamin
stuff like
with
that?
mineral? I think fish oil does almost nothing. I think eating fish twice a week does something. And the best way to figure that out is bite into a fish oil capsule and compare that to biting into a good piece of salmon.
I wouldn't recommend that.
It's clear that salmon is better.
Go to Kathy in Belleville. Hi, Kathy.
Hi.
My pertussis vaccine, or the DTaP, I guess, would be 10 years in April. With a new grandchild, is that something I should get now and not wait till the 10-year duration?
Keep your DTaP up to date. It's every 10 years. If it's 1 week or 2 weeks less than 10 years, your insurance and Medicare probably won't pay for it. There are different rules that govern that. But I mean, when they say 10 years, they mean 10 years. It means you really are safe for that. Once again, check with your physician. Sometimes you may have other medical problems that interfere with that. But generally, it's 10 years. And
10 years is 10
the
years.
rules of 10 years is 10 years.
Okay. Let's go to David in Beloit. Hi, David.
Hello. Hi, Mark. How are you doing?
Good. What's your question?
I have a question. I talked to you guys, I think it was the beginning of 2016. I had prostate cancer, and I had Lupron shots and 28 treatments of radiation. And come to find out, the radiation burned ulcer in my rectum. And they just put me on, let's see, 2 weeks ago on the Cafafate solution, I think it's called, or Cafafate. And I just wonder how well that works, or do I need to get cauterized afterwards?
Well, the real thing is radiation destroys the prostate. That's what it's there. But the rectum and the colon is right near the prostate, and sometimes that gets destroyed too. You've got to have a good gastroenterologist that's looking at it. You've got to stay on the medications. And the problem is it's sort of a late complication of radiation, something that you have to work with. Sometimes you actually need surgery for that. Sometimes it can be handled quite often with medications and creams. So good doctor, good relationship with your doctor, that's the right way to go with this. It's not an uncommon problem. It is a common problem. Yes.
Right. And tattoos, going back to that. Concerts, rock concerts. People get them at rock concerts.
Yes, commonly get them at rock concerts. I don't know about you.
I didn't know that.
Well, when was the last time you went to a rock concert?
That's
exactly it. I mean, come on.
Oh, dear.
Come on, how many rock... Oh, dear.
Frankie Valli, I think it was.
That's right. It is common. If you look at a rock concert or go there just out, out in the parking lot, there are tattoos all over the place. And that is probably a good example of where not to get a tattoo, a place where you don't want to have that. And that's, I think, where education of your child comes in. Just like you talk to your teenager about sex, talk to your teenager about tattoos.
And piercings.
And piercings.
All right. Zorba, thank you.
Great to see you, Zorba.
Well, good to see you
Thank you
guys.
for calling in, everyone. Good questions. And we'll do this again soon.
Yeah, pleasure.
We'll be right back with a final check of your forecast.